businesses start reopening across New England with new sets of rules to follow, it's important to consider how we're dealing with risk in a world after the first COVID-19 surge. For example, restaurants in New Hampshire and Rhode Island are opening up again, but with strict social distancing guidelines, like only allowing outdoor dining to reduce the risk of infection for those who choose to eat out right now. Sue O'Connell has some thoughts on harm reduction and how that concept will be applied to our lives going forward.
I want to talk to you today about harm reduction. It's a phrase you're going to be hearing a lot of over the next few days, months, maybe even years. You're already familiar with harm reduction, I'm sure. It's the idea that you take a risky behavior and try and find ways to reduce the amount of harm that it brings. It's often used with folks who use intravenous drugs illegally. Health officials will come in and try and do clean needle exchanges because dirty needles will spread hepatitis and HIV/AIDS. If you bring in clean needles, it reduces the harm to the drug users. It doesn't change the addiction, doesn't change the use, but it does keep the people using drugs safer. It's also something that we do every day when we get in our cars. The government helps to keep us safe by doing something that is inherently and clearly dangerous, driving a car. So there are seatbelt laws, and the government requires that we get our car checked for safety once a year. That's a method of harm reduction. And why am I talking about harm reduction right now? Well, because it's what public policy people are going to be talking about in the coming months regarding opening up businesses and society. It's pretty clear under COVID-19 that we're not going to have a vaccine anytime soon, and we may have sadly and tragically missed our opportunity to contain the virus, but we're not going to stay closed forever. And it's also not a binary choice. We're not either going to open or close, we're probably going to do a little bit of both. So a phrase that you need to know as we get through this next stage of the COVID-19 pandemic is harm reduction.